So I'm here today with Glenn Schaube. Welcome, Glenn.
Hi, Anne. Nice to be on.
Oh, so you do a lot of work for Massage and Myotherapy Australia under your company GRS Communications. So do you want to tell us a bit about who you are, what you do?
Yeah, okay. Look, I've been in government relations, public relations for about 35 years. I did a degree at Deakin University. I worked in various government and private sector organisations, a lot to do with government relations work, media work, and issues management. So 20 years ago when I started GRS Communications, I specialised in those areas. And during that time, we've worked mainly, or predominantly, we've worked with associations. And we also do some community-based marketing for non-for-profits such as colleges and things like that, and community-based marketing for small business.
Right. And so what's your main role with Massage and Myotherapy Australia?
Well, I'm assisting the association in advocating on behalf of members.
So on that note, what's the difference between advocating and lobbying?
There's a big difference between advocating and lobbying on behalf of an organisation. So a lobbyist is a registered function that's legislated federally. And essentially a lobbyist advocates on behalf of an organisation. So they make representations to parliamentarians, they walk the halls of Parliament, and so on.
So the association focuses on advocacy, and that's your role with us.
Yes, yes, that's correct, Anne. We help the association advocate on its own behalf. So rather than making representation to politicians and so on for Massage and Myotherapy Australia, we help the senior people become respected voices and known voices within government, so that when they go and approach a politician or a bureaucrat, they're already known and their opinions are respected and listened to.
So how does that advocacy work in that, we don't go and knock on doors or with...
Well, there's a number of ways of doing it, but essentially it's an educational approach. That means rather than confronting politicians with what they're not doing, you're educating them in areas of policy that they can do. So no politician really wants to be regarded as not providing policy and reform for the benefits of Australians or their voters. So our approach is to help them find that place where they can actually help as many people and as many interest groups as possible. So that means understanding what pressures they're under and what other groups are that may be in conflict with our interests, understanding where they're coming from, and finding a path for politicians and policy that can serve all interests.
And that, on that note, because massage and myotherapy is an unregulated industry, there's a lot of misinformation out there and confusion, and that's been shown in the last couple of years in COVID as well. So what have we, you've worked with the association for almost 7 or 8 years now, I believe. So what have we achieved over, even in more recent times?
Look, the interesting thing about government relations is that it's a slow burn.
Yes.
So when you think about the way government functions, it's rare that unless there's a crisis, a national crisis like COVID, or unless there's an incident that requires legislation to be passed through Parliament rapidly and demands a response, the process of policy change is quite a slow one. So when you think about it, they go through, it usually takes a 3 to 5 year planning and implementation process. So they've got a plan for it, they've got to do their research, then they have to put it to the politicians, they have to agree to the policy change, then it's got to be put into a budget, and then the budget has to be made available. So that's quite an extended process. So you very rarely get instant results. what we've managed to achieve over the last several years is, first of all, probably the biggest one and the earliest one was the private health insurance rebate. So we made representations to the Chief Medical Officer, to individual health ministers and so on around the country through written submissions and some face-to-face presentations with their advisors. The positive result was that massage remains and will continue to remain included in the private health insurance rebate scheme. Other areas of success have been with the skilled migration program. So I think it was about 3 years ago or 2 years ago, they no longer included massage therapy in the 2457 visas. And we made some pretty strong comments about that and made it clear that there was never a shortage in Australia of low-skilled massage workers. So they're just two examples.
Yeah, which is terrific. And those sorts of things take months and months, if not years, to get a result, don't they?
Well, that's right, because the wheels of government do work slowly. And when you think about it, there's a lot of other interest groups that have issues that they're trying to serve as well. So in the case of the private health insurance rebate, you know, there's insurance companies, there's hospitals, there's private hospitals, there's all sorts of competing interests that are looking to benefit from government policy. The least of which are, you know, GPs and allied health practitioners. So we're in competition with them to try and be recognised for the services that massage therapists provide.
And it is, you touched on it earlier, it's very much an educative process of educating the stakeholders, external stakeholders, the benefits of massage, where massage fits in the health sector, and why it's important.
Yeah, that's exactly right. It's, for example, if you're looking at, say, a physiotherapist who can provide massage and does provide massage, they have an interest in being able to provide that service. So, and there are something like 15 or 20,000 registered physiotherapists in this country. That's a lot of massage service already out there. So we are trying to get recognition for the skills of professional remedial massage therapists and myotherapists in the context of all the physiotherapists already out there providing the same service.
Yeah, and that is a very pertinent point, that it's qualified therapists. So
that's exactly right, and that's the other issue that we're up against, is that, you know, for the medical fraternity and government, they have to be sure that what they're funding has a level of efficacy that they can be confident in. In other words, they need to be very confident that a service they're paying for is going to benefit, because they're subject to public scrutiny.
That's right, and efficacy is a big word that we use a lot, isn't it? And I know you spend a lot of time, and I spend a lot of time finding research, valuable research, for our arguments and our advocacy work. So, and it is increasing the research area, isn't it?
Look, data, everything comes back down to data. So if you go to a politician or a policymaker or a bureaucrat with an argument saying, look, you know, massage is valuable, they'll say, show us the data.
Yes.
If you say there's an oversupply of low-skilled massage workers in this country, they'll say, show us the data. It's the same with medical and health research. There is a high degree of risk for GPs to recommend a pharmaceutical or a therapy, because they will be held responsible if it doesn't work, or if there's a negative reaction in the case of pharmaceuticals. So you've got to, from our point of view, we need to be very aware of that risk. And that's why research into the efficacy and value or benefit of massage therapy and myotherapy needs to be very strong. One of the main reasons that the private health insurance rebate continues to include massage is that the review of the research that was around back in 2012 demonstrated that there was a level of research that had a high enough quality to justify including massage in the private health insurance. In other words, it suggested or showed that there was a benefit that was worthwhile. So that's another challenge for us, is to gather enough research that is of reasonable quality, that it demonstrates with confidence to medical people and medical practitioners that it is of value.
That leads us into the last couple of years that has been quite difficult for the massage and myotherapy industry with COVID-19. More difficult in some states than others. Allied Health has, whilst we're not deemed Allied Health has found it difficult, particularly here in Victoria. So do you want to talk through the process of how we've worked and what we've done over the last couple of years to try and get answers and information to the stakeholders and who it's been with?
Look, I mean, COVID has been a very interesting time and a frustrating time for all of us because of the lack of clarity and uncertainty about when a massage therapist was actually eligible or regarded as able to provide services. But really, it stems back to the bigger issue of confidence in massage and where it sits in the health system. So if you look at the Medicare rules, Medicare funding provides funding for allied health and medical and pharmaceutical benefits. Massage is not included in that unless it's provided by a physiotherapist. Medicare provides funding for allied health professionals. Remedial massage therapists and myotherapists are not included in that definition and aren't members of AHPRA and are not regarded as allied health professionals in the medical and health system that is run in this country. That has defined how massage is regarded throughout COVID. So when you're considering what we've done to advocate on behalf of members during the COVID period, you have a look at the whole picture. Now, during that period, since COVID came into being or came into Australia, we've made about, I think it was 100 different submissions, media statements, stakeholder advice and educational material during that period and distributed it widely through the health community to politicians and so on. That's covered issues like service provision to aged care, oncology, palliative care, veterans and so on. So wherever there is an opportunity to demonstrate that massage and myotherapy have a benefit for patients and clients, we are making submissions and letting people know that massage has an important role and already plays an important role.
I think that the difficulty for us to really understand the government directions is it's a numbers game for them as well. In Victoria, in Sydney, it's about restricting movement as opposed to restricting services. And that's a lot of their decision making as well.
Yes, that's right. And I think, look, the fact that allied health professionals were restricted in Victoria, and just as much as massage and myotherapy therapists, tells you that the government wanted to limit personal contact between people. That's really what it came down to, because that is the highest area of risk for transmission of the disease. You combine that with the Medicare rulings and restrictions on what it's funding, and that provides a guideline to state governments and all health agencies and health providers. That is the underlying barrier that has limited the access for massage therapists to continue to provide services. Now, in some states where the risk was a bit less, like in Queensland, where there were less numbers of COVID cases, or Western Australia and so on, that hasn't been the case. They've freed things up, but they freed things up because the risk was a lot less. In New South Wales and Victoria especially, where the risk was regarded as much higher, those restrictions were a lot tighter.
Yeah, and unfortunately, or fortunately, whichever way you want to look at it, it is a state, public health is a state responsibility, and that's where massage falls. So Yeah,
Yes, it is very much a state responsibility, but it is guided by the Medicare provisions.
yeah, yes.
And that's why that at a federal level, we need to continue working to educate them about where clinical or professional massage therapists fit into the health picture.
Yeah, we've received a lot of emails and phone calls from our members suggesting that we should be more aggressive in our advocacy work. What would you say to those people?
I think you've got to be careful what you wish for. Um, you can be very aggressive and very critical, but that will only alienate you with policymakers and politicians. If you're constantly critical of a politician, it doesn't help them.
Mm,
And yes, you may get a little bit of coverage in the media for, saying something controversial or being really critical, but that can do irreversible damage and create a barrier for them to actually listen to what you're saying. You want people to listen to you and understand the solutions you're offering. So that means building positive relationships, not negative ones.
the other question we've had a lot is why haven't we started a petition? You know, I
Yeah,
suppose take it back a step. What's the purpose of a petition?
well, look, the hope in petitions are interesting instruments for creating awareness amongst politicians. The difficulty with petitions is that they are a predetermined document that's written by one person or one organisation, and then they are requesting other people to sign it. Now, because of that, the government and policymakers regard petitions as a very low commitment by all the signatories. So in other words, they're not investing very much of their time, they're not investing any of their own dollars, they're not actually demonstrating their own vested interest in the particular issue that they're supporting. That means that petitions are regarded as having very low value and usually regarded as, a one organisation, a submission by one organisation. It doesn't actually multiply the impact. Unless you have, 200,000 signatures, it really doesn't have a lot of impact.
On that note, with petitions, I think from our members' perspective, they possibly feel like they're contributing to our advocacy work if they sign a petition. So, what could members do to support the association, assist with our advocacy work, other than a petition?
Yeah, it must be frustrating at times,
Yeah.
especially when you can't work and you've got financial pressures and stuff like that. It must have been very difficult, and I know just in my own business it's been difficult at times too. I think the first thing to remember is that because you're part of an association, you're actually regarded as having a collective voice of 8,500 members. Now, the association has also been working with other associations to multiply that voice and create a single voice for the professional massage sector. That is probably the most powerful way of influencing government because all governments want to hear what the industry wants. So if you look at all self-regulation, all privatisation is really very much about giving industry control of its own destiny. But where an industry is divided and you have several lobby groups or several groups advocating for different things, it confuses the message and makes it very difficult for government people to actually make a decision or define what is the real situation. So the work that's being done in terms of trying to create a collective voice for the industry and the professional associations is most important. The other part to what the association is doing is to create a professional industry and create a professional association. So over the last 10 years, the requirements to become an accredited member of Massage and Myotherapy and some of the others are virtually equivalent to becoming an AHPRA registered practitioner. So what that means is we can now demonstrate that members of the association are professional health providers. Having done that builds a professional reputation of massage therapists who are registered with the association. The best thing members can do is to participate in things that will make them and the industry appear more professional. So that's the certification program, for example, because it's providing a quality assurance to GPs and other people who can refer patients to massage therapists. It's providing a little more confidence in the professionalism. They can undertake professional development and become educated and in using the correct terminology and being able to report to GPs about what services they may be providing to their clients who are patients of those GPs. At another level, if anybody wants to get involved in advocacy, the best thing you can do is have a number of local massage therapists write directly to their local member. If that happens across the country and you're getting letters sent to several local members within a community, so it might be the opposition, it might be the sitting member, it might be the federal or the state member, you're multiplying the number of times or the reach that that the massage industry can have. It makes it an important local issue, which then gives license to local members to take it to caucus or take it to their party and say, look, this is an issue that's been raised in my electorate. Now, if that's happened across the country, other politicians are going to be saying the same thing. Yes, I've received similar letters. I've been told that there's some issues in this sector. What can we do? So that, in my opinion, is probably the strongest thing that people can do. Now, the way to do that is not to be aggressive, not to be critical, not to say that the government is failing, but to say this is an important issue for me and my business. It limits my ability to earn a living. It limits my ability to provide services to people in need. These are the messages that will resonate with your local politicians because it affects their voting public.
All right, well, on that note, thank you so much for your time. I do appreciate it, and hopefully those that have watched this are a little more informed about what the association has been working on and trying to do throughout this pandemic for our members across the country, not just in those states that are in lockdown, but we'll continue the work, our advocacy work, into the future.
Yeah, thanks, Anne. I think if anything, I hope that people have understood that it is a very complex area and it's a very slow-moving area, and that we are working very hard to bring about change for the benefits of the members.
Absolutely. Okay, thanks, Glenn.
All right, bye.